So I want to welcome you all to our second Prevention Thursday. Maybe some of you are joining us for the first time. Perhaps some of you are back again. Thank you to all for being here. I want to start tonight really out on a serious note. This past Saturday, a young man named Jonathan Price saw a domestic violence incident happening in Texas. He was a really well-known and well-respected man in Texas, and he intervened in that scenario. And after it was resolved, officers that responded to that situation, Jonathan Price went to shake his hand, and the officer thought he was intoxicated and tased him and took Jonathan's life with 4 shots. You know, all forms of violence and oppression are intertwined, and there really are just no words for this young man and so many others that have lost their lives to racial injustice and to the oppression in this society. And so I want to offer a moment of silence for Jonathan and for everyone else who has lost their life to domestic violence, trying to help someone in a domestic violence situation. There is no survivor justice without racial justice. And so I just want to start off with a moment of silence for them. No moment is long enough, but I hope that we are all learning more this Domestic Violence Awareness Month about how to help survivors and how to end all forms of oppression.
Thank you, Stephanie, for taking a moment to honor and bring attention to the impacts of racism on domestic violence. To begin our conversation this evening, here is a video from our President and CEO, Diane Williams.
Hi, everyone. My name is Diane Williams, and I'm the CEO of JBWS. Thanks so much for joining us tonight. Tonight, you're going to be learning about the impact of COVID on survivors of abuse and what you can do to help. And to get that conversation started, I wanted to talk to you a little bit about, as a provider of domestic violence services, how we experienced the pandemic. This pandemic seemed to come out of nowhere. We went from being able to go to work and school and shop at the grocery store to all of a sudden being told that you have to stay home or you're going to be in danger. That was really scary for all of us. Do you remember that access to basic necessities like food and water were all of a sudden just not readily available? The governor's statement to stay home, stay safe seemed to make sense, but not for victims of domestic violence. They were literally trapped at home with their abusers. At JBWS and across the state and the nation, the helpline stopped ringing. There was an eerie silence. And we knew that domestic violence had not disappeared. It had just gone further underground than it ever was before. Perpetrators had an increased access to their victims, an increase in financial stressors, concerns around getting the illness itself, and one of the biggest factors that contributes to domestic violence and danger, isolation. This put victims in danger now more than ever before. So tonight you're going to learn more about what those victims have experienced during the pandemic, what they're still experiencing, and what you can do about it, even if it's just one thing. Thanks so much for joining us, JBWS, in not tolerating the presence of domestic violence in our community.
Thank you, Diane, for welcoming us all and opening tonight's conversation. As Diane shared, tonight we will be talking about the impact of the COVID-19 pandemic on domestic violence. We will be going through a series of frequently asked questions to share with you all about JBWS's response to COVID-19 and its impact on survivors. Stephanie, when talking about domestic violence, there are clear risk factors. What about COVID-19 has increased or changed risk factors for survivors?
Oh my gosh, Maddie, so many things that we normally associate with risk regarding domestic violence are just part of the procedure with relation to COVID. So, for example, the isolation that we're all feeling. I know this is something that we're all feeling right now. When you are living in a home that's abusive, that respite away from home, the time with friends and family, time at work, those activities that are relieving stress and giving you a break from home are so critical. And families don't have that, right? Families where there's abuse are just kind of trapped together, right? That idea that your home is the safest place really doesn't apply for families that are trying to navigate abuse. And so that is kind of the biggest factor that first comes to mind, but then so many other things, right? We know that financial hardship has just been part of the name of the game for COVID. We know that in times of economic insecurity and uncertainty, people that use abuse become more abusive to try to regain that feeling of control. And not only do we have this current financial crisis, it's this huge question mark for the future. Just nobody knows when things are going to change. And that uncertainty really just compounds the stress that families are feeling regarding economics. We know that alcohol, liquor stores were deemed essential. My brother and I had a little back and forth about this. He said, could you imagine the mass chaos that would break out if liquor stores had been closed? There would be no way for people to be pacified. And I hear that, but certainly for families where there's abuse, when you're adding alcohol, when there's already the stress and the financial hardship, it is just really kind of turning the volume up and making it even more dangerous. We also know gun sales were up, and that just access to a gun can make it more dangerous for a survivor. All these things have an impact on any DV case, right? We have a tool that we use to assess danger for clients and to look at knowing that not every case is equal danger, right? And that on that tool, all these factors that we were just talking about related to COVID indicate an increase in danger. And so we just know that there are so many things pressing down on families due to COVID that are trying to navigate this abuse. Oh, Maddie, you're muted.
I just realized, thank you. Thank you. I think that really helps give us a good idea of what some of these risk factors are and what someone might be experiencing. As you shared earlier this evening, there's a clear correlation between racism and domestic violence. How is domestic violence impacted by racism?
Thanks, Maddie. I think this is such an important point to really explore. We know that the ways in which an abusive partner maintains power and control over their victim are the same ways that a population is oppressed, right? That power and control is gained over that oppressed population in our society. So you have all these factors that someone's experiencing within society mimicked in their relationship. So it's just a repeat of that trauma. And then beyond that, when you think about all these factors really as maybe barriers to someone being able to navigate out of that abusive relationship, you can't ignore systemic racism and the oppression that people are facing as they navigate systems, right? We know that, for example, people of color are more likely to be working in positions where they're required to go in person, where their health may be exposed in relation to COVID. And so you have all of these things really mixing together. We know that communities of color were at risk for domestic violence, higher at risk for domestic violence prior to this. When we look at the way that COVID is making things more dangerous and the increased impact of COVID on communities of color, we can't separate these issues, right? We have to look at a whole person and everything that they are facing and they are navigating. And when someone is getting free from an abusive relationship, the fact that they have economic insecurity related to their racial oppression is a factor. The fact the ways in which our systems might respond with implicit bias is a factor for survivors. And so you just can't kind of talk about one without the other, right? We all bring our whole selves no matter where we go. And so someone's experience with racism is always relevant to their experience with domestic violence. Oh, you're muted again.
I clicked it. Thank you for taking the time to highlight that. I think that was very important for us to address this evening. The dynamics of power and control play a huge role in domestic violence. Has this increased or changed due to the COVID-19 pandemic?
So, it hasn't caused abuse where there wasn't abuse before. I want to be really clear about that. I think sometimes when we hear the idea that, oh, cases are on the rise, people are thinking, are these like happy, healthy relationships that have somehow become abusive because of COVID? No, that is not the case. It is really that these situations where perhaps the abuse was happening on a less frequent or a less noticeable basis have been exacerbated by our current climate. And so, when we look at what's happening for survivors, our traditional power and control wheel is always going to apply, but there are even more tactics that abusive partners can use. And they can install these new rigorous control tactics in a vein of I'm keeping the family safe, right? So perhaps I have, a really strong network. Maybe I'm in like a book club and my book club has found a way to be distanced and safe. And it's really important for me to go to that. My partner has decided that that's a risk for the family, right? Well, you can't go to your book club because you're going to put the family at risk. And so that isolation, while normally I'd maybe be able to say, no, it's really important, I'm going to go, that justification gives it more weight. And so that's what we're seeing a lot, is that the COVID is being used as like the reason, and this kind of valid reason to have more control, more isolation. I have to watch your hands when you come in the house. Threatening, perhaps I work in healthcare and my partner threatens me that if anyone in the house gets sick, that it's my fault and I'm, going to be in a world of pain if that happens. And it can also be, I think a lot of times with abuse, it doesn't necessarily make logical sense. So my partner could be berating me about their concern that I'm going to bring COVID into the home while simultaneously walking around without a mask and using that as a tactic to threaten me or coerce me, right? That doesn't make sense for one person to be doing those same things, but it's really just about using COVID and the fear that people have related to it and the restrictions that we are kind of like more willing to accept because of it, using those to gain power in the relationship. And so, so many different tactics related to that, and sometimes involving the children, right? So if I don't do what my partner says, maybe they're going to take the kids to the store without masks on, right? And so maybe I'm just going to do what my partner says because I want to protect my children. And so you can see on and on how it might go, where all of these different factors are justified under the means of COVID, and really kind of painting survivors in this corner.
Thank you so much. So our next question, has the COVID-19 pandemic shifted the services your agency provides? To answer this question, we will be hearing from one of our essential workers and transitional facility program case managers, Kim Villafara. So I'll be pulling up that video now.
Hi, my name is Kimberly Villafara, and I am the case manager here at our transitional living program at JBWS. I want to talk to you a little bit more about COVID, its effects on our clients, how our staff has adapted, how our services have responded, and just life as an essential worker throughout this pandemic. First, I'm going to talk to you about just the safety precautions that we took during the pandemic and are continuing to take. Procedures were put in place for staff members to work remotely. I was the case manager, so I remained on site throughout the pandemic, working limited hours, ensuring that I was on site in order to provide items and services to clients that I would not be able to do so if I were working remotely. That being any mail needs, providing more PPE gear for our clients, putting up signs around the building just to ensure that clients are remembering to use hand sanitizer, wear their mask, and have one family on elevators at once. So just like to be able to communicate with our clients some things that I would have more trouble doing if I was working remotely. As well as that, we did provide all of our clients with PPE wear as well as our staff members. We let them know consistently that if they needed any more to please come to us and we'd be able to provide those to them. So we made sure that we kept in all the common areas cleaning products as well as hand sanitizer and sign-in sheets just to keep track of who was coming in and out of each area and ensuring that people were cleaning up the areas after themselves. The same thing for staff members. Staff members had to clean the areas that were used daily and sign off on it just to keep track of the cleaning that was being done around the building and in each common area. We limited the use of common areas to one family at a time. So like I mentioned before, the elevator is one family at a time, continues to be that way. Our social rooms, the playground area, which was something that our families really wanted to use during the summertime, was also limited to one family at a time. Our library, obviously in the hallways, we can't expect it to be one family at a time, but we did remind people to, socially distance, be 6 feet apart, and to try to avoid or limit the amount of contact they had with individuals. So those were our safety precautions that we took. We continue to have the wearing your mask requirement, just hand sanitizer in the front of the building. So when you come in, we have our staff members and our clients still signing in and out just to make sure that we're keeping track of who's coming in and out of the buildings. As far as visitors go, during the pandemic in the beginning months, we did stop the visitors just to limit the amount of individuals who were coming in and out of the building and, just keeping it at a staff member and the residents who were here. So that's what we did for safety precautions. So just to talk a little bit more about what it meant to be an essential worker or what that experience was like. I mean, living through a pandemic and working alongside with clients, you were living it. I came into TLP every single day, and this is where my clients live. So, seeing the struggles that they were experiencing every single day, how the news were affecting them, the fear that they had, it was a lot. And I think what I learned out of this whole experience is just like the value and the importance of community, of coming together. I think that as JBWS as an agency and our residents as a community, whether they were at our safe house or our transitional living program, they all really just came in together and supported one another as much as we could, despite having to communicate in virtual spaces. You know, I saw clients sharing items, essential items with one another, sharing information with one another, sharing news with one another, just supporting each other in ways that, you know, we all needed throughout this pandemic. So it was an honor to be an essential worker. I know that there's a lot of work that still needs to be done, and we're all just trying to get through it together. But that's a little glimpse on how JBWS here at Transitional Living Program adapted to COVID. Thank you, everyone.
Thank you, Kim, for taking the time to share with us the impact COVID-19 has had on JBWS's services. Stephanie, is there anything else you wanted to share with our viewers tonight about JBWS's services?
Yeah, I just wanted to let everyone know that not only are our in-person residential services up and running with bare bones staff and really essential safety measures, all of our services are being run virtually. We have advocates that are working in the courthouse, our Family Justice Center, our community counseling program, our TFCBT, which you'll hear more about next week during our Impact on Children session. There are so many ways that survivors can get connected and be supported. It doesn't have to be in person. And that's actually one of the really great things that we've learned about from this pandemic, is that staying connected is so critical for survivors, and there's lots of different ways that we can do that.
Absolutely. Thank you for sharing. So our last question for this evening: if I'm concerned someone in my life is a victim of domestic violence, what can I do to help them?
Well, I think, first of all, you can give yourself a big check, because the first thing that we need to do is be aware, right? And just by being here and listening on this webinar tonight or this Facebook Live, however you're joining us, you are a part of the solution, because the more information you have, the safer everyone else you know is, because you are now an awareness ambassador, right? Just by knowing this information and sharing it with your loved ones and your community. So you can, you know your loved ones. If someone seems off, right, I think we're all operating on maybe a little bit less than our best selves during this pandemic. But, if someone seems really not their best self, it's okay to check in, right? And we can start that conversation in relation to the COVID and some of those things. And it's okay to ask someone that you care about. If they don't want to talk about it, they don't have to talk about it. But being aware and opening up conversation is something that can really help someone that is in need. You want to make sure, of course, that you're reaching out safely. You can ask someone how they would like to be contacted, what's the best way to contact them. You can make a plan, right? If you know that person is navigating an unsafe situation, do you want me to call you on the landline so you have to leave the room in order to talk to me? Are there ways that we can set up virtual play dates for the kids together? Finding unique ways to connect, where if that person is being watched or monitored or having restrictions on the contact that they're allowed to have, maybe finding a way to be connected despite that. You can also send necessities, right? If you know someone's abusive partner is hoarding all the Clorox wipes because they've decided they need them more than the victim does, maybe just, those concrete needs, sometimes just having the things we need makes us feel so much safer. Using the power of your relationship. Perhaps your loved one is the person that's being abusive. They're not bad people, right? These are all people that we know that are part of our society. And so if you know someone that is being abusive to their partner, it's okay to check in with them and say, hey, this has been a really stressful time. How are things going? I heard you snap at your partner the other day, and I just wanted to see if everything's okay. Because truly having someone that's using abuse acknowledge that and change that behavior is really the only way to end domestic violence. You can help someone assist in basic safety planning, whether you're keeping some items at your house for them or helping them think through creatively how they might navigate a situation, right? If all their texts being monitored, well, can you, if things get really bad, can you say you need to go to the pharmacy and call from there, right? Call the shelter or call the police from there, whatever feels safe to you. Giving them information about JBWS services, letting them know what you learned tonight, that it's not their fault, that services are available, and taking care of yourself also, because certainly nothing is going to be as challenging as being the person navigating an abusive situation, but loving someone that's navigating an abusive situation is very hard too. And you need to make sure that you're not being a part of that isolation, that you're doing whatever you can to stay connected to that individual. And you might just need some self-care for yourself in order to do that, to maintain that presence. And really just, being open and compassionate and knowing that being a place where if someone is ready to talk about it, if they want to talk about it, they know that they can and that you're there to support them.
Awesome, thank you. So now we do have some time for some questions at the end. If anyone in our Zoom space here or joining us on Facebook Live had any questions, I've been monitoring Facebook and I haven't seen any questions come through over there, but I just wanted to give everyone a moment in this space if they had any final questions before we wrapped up this evening.
It doesn't seem like we have any questions from our Zoom group either, but I do want to thank everyone for joining us this evening and for taking some time out of your busy schedules to learn about domestic violence and perhaps take this knowledge and use it to help someone that might be in danger. So thank you so much, everyone, and we hope to see you next week.
Thank you for joining us this evening.